our grant fund, we started off with creating a rapport at the county, at the health centers. You know, when you create a rapport at the health centers, they have a buy-in, they accepted, and they were willing to participate with us, especially in the mapping. And once we did the mapping and we got to know who is dealing with reproductive health, who is dealing with youth-friendly services, we were good to go. And I'm sure with the support of Center for Study of Adolescents, they work there. The National Council of Population, they also work there. It was a good rapport that had already been created.
We were able to convince them that there was need for them to do something like put resources for young people, because from the data we found out that indeed youth-friendly services are missing from these facilities. They're inadequate.
The county people promised during one of their way forward that they were actually going to initiate the process of including more resources for youth-friendly services. And that was a big plus for us, because getting resources set aside just for the youth-friendly services was going to enable more young people to access more information on family planning and at the same time sexual reproductive health. We managed to talk to some of the county health people, and they said bringing on board the, what do you call an MCA? Member of the county assembly. That is at the small level of the ward. When you have those people of the political goodwill have a buy-in, then they can be able to also advocate during the assembly meeting to make sure that there are funds and resources available for youth. And they are actually happy that we managed also to bring on board the people in charge of youth services, not just health services, but youth generally. And when you get them on board, they have all the holistic approach, health issues, economic issues, social issues, because they build it onto the family planning and sexual reproductive health. So that was a big plus for us, because we got them on board, they attended, and they were happy that they were going to advocate through the political goodwill.
We had to have a buy-in from the county bosses of health, and that is something that we did. And with the help of the government institution that was among us, we were able at least to get through them, and we talked to them. And during our validation meeting, when we were having the report disseminated, they were very happy, and they really say that they are going to push forward for that particular item that we were advocating for. In addition, we are currently going on with M&E, and we are also going to check whether those things are in place, and if they are not in place, we'd like to know what are the challenges, what is making them not actually go forward with the youth-friendly services that they promised that they are going to put in place.
I feel so proud that I'm part of something that is going to help one youth make a difference in his life.
This particular experience, especially the small grant, was important for me. Whenever I went for interviews and I was able to explain myself, and most people would be very excited about this, and they would notice that this was an opportunity that actually changed my life. So yes, in terms of impact, when I went for interviews, I would use this example, and previously I did not have such good examples to offer in terms of practical work and hands-on work that I had done before.